Hoffman. I'm the discharge nurse up in North 10, and I'm going to speak to you about preparing to go home. If you live locally, you'll need to prepare your house for the patient coming home after being on North 10. Or if you do not live locally and you are going to be staying at doorways or an apartment in town, these guidelines will help you as well. If you're going to be returning to your home, we want to make sure that the house is clean. It does not have to be professionally clean, but if you're going to be vacuuming and things like that on the days after the patient comes home, the patient cannot be in the room where that vacuum is running. We also ask you to turn off your humidifiers there at the house, and especially when the weather is nice here in the spring and in the fall, we do not want those windows open. If you have houseplants in your home, they need to be removed from the area in which the patient is going to be staying. That doesn't mean that they have to be removed totally from the house. As upstairs on North 10, we do not want any fresh flowers or potted plants being delivered to the patient, nor do we want fruit baskets coming in. They can receive visitors if that patient is up to it. If the visitor shows at your door and they say, oh, I think I need to be wearing a mask, I've got the sniffles today, then they do not need to be visiting. However, they do not need to wear a mask when they are visiting with the patient. We do ask everyone to wash their hands when coming in and to follow our guidelines as far as children visiting with the patient as the same as they were upstairs. If they're small children and they're requiring immunizations, you need to follow our guidelines and our bone marrow transplant patient education manual. If you have not received your manual yet, you can download that on our website through Massey. However, if you have received it, you probably will receive that manual at the second consultation. So no open windows with that patient when they are in the house. If the patient wants to go outside, sit on the deck, walk around the neighborhood, that's perfectly fine. They must wear a mask at all times when they are outside or not in their home. Even in the car when they're coming to clinic, they need to be wearing their mask. Exercise we encourage. If you're going to be walking around your neighborhood, as I said before, you need to be wearing a mask. We do not want you walking in areas where they are doing new construction or your neighbor is doing gardening. If your neighbor is out in the yard and they are mowing the grass, they're raking leaves or cleaning their gutters, you do not want to be outside at that time. We also don't want you walking in heavily wooded areas, which is very shady, which has a great deal of mold in that area. We want you to stay away from that at this time. On your first day in clinic, we encourage you to pack a lunch, bring 2 snacks with you because you do not know how long you're going to be in clinic that day. We also ask you to bring all your medications with you that you will be needing during the course of that day, including your as-needed medications. Let's talk about once you go home and say you're at home and you spike a fever, temperature 100.4 or greater. We need you to give us a call. You will be giving 3 sets of numbers that you can call. One is for the clinic, one is for the inpatient floor, and one is the number that you call to make appointments. I will give them to you prior to your discharge, or if you've attended our caregiver class, you will receive those as well. If you spike a fever and it's during clinic hours, we want you to call our clinic. Clinic is open on Monday through Friday between 8 and 5:30, and on the weekends they're open from 9 until 4. You will always have a health care provider available to you, so if you spike a fever after clinic hours, we want you calling us up on North 10. We do not want you taking any Tylenol for your fever. We want you to call us and then we will instruct you as to what to do. Because if you take Tylenol, your fever will come down. And we may want to bring you over to our clinic or to the inpatient floor and obtain some cultures. So if your fever has come down, and we obtain some blood cultures, we may not be able to capture the bacteria or fungus that's causing you to have an infection. So if we ask you to come in and it's after hours, it's at night, North Hospital ground entrance is locked for security reasons. So we'll ask you to enter the hospital system through our gateway building, or you can come in through the patient visitor parking deck. On weekends as well, our North Hospital is locked, and you will have to be coming in through the gateway building if you're coming to clinic. So what do you call 911 for? In your patient education manual, as well as our manual that is on our website, there is a sheet that says what you call 911 for, what you call the clinic or North 10 for immediately, and what can wait until the next day. Things that we want you to call 911 for: if the patient's unarousable, if they're having chest pain, if you think they've had a stroke, if they're bleeding profusely, or if they're having difficulty breathing. You call 911, and they will give the patient the assistance that is needed, and then they will get them transferred over here to us at VCU if you go to an emergency room that's not VCU. Things that we want you to call us immediately for is if you've got a fever, if you are having nausea, vomiting, or diarrhea, and you've had more than 3 episodes in a 24-hour period, or your nausea medications are not taking care of your nausea. If you develop a rash, we want to know about it. If you are seeing blood in your urine, in your vomitus, in your stool, or if you're coughing up blood, we need to know about that immediately. We also want to know if you are having difficulty in breathing, shortness of breath, if you've got a dry cough or a productive cough. We need you to give us a call. So, your platelet count is not going to be normal when you leave the hospital. So until your platelets are 50,000 or greater, we do not want you having any sexual activity. But once your platelet count is 50,000 or greater, we want you to follow the guidelines in our patient education manual. We also do not want you using a toothbrush or using dental floss. So we will provide you with spongettes that we will have you use. You use toothpaste on there, use them one time, toss them away. We can provide them for you on the unit. So until your platelet count is 50,000 or greater, you're going to be what we call thrombocytopenic. So we want you to follow those guidelines. We also don't want you using a regular razor, use an electric razor. We do not want you driving a car until the physician tells you that it is okay for you to drive. We do not want you going back to work until your doctor tells you that it is okay. You're also going to be neutropenic. You're going to be more susceptible to infections. You also will have to be re-immunized at some point after your transplant. So we need you to not go out to eat, avoid large crowds. If people are sick, tell them to stay at home. Follow our neutropenic guidelines that we're going to give you on the unit prior to you leaving. And as I said before, if you have fever 100.4 or greater, that is something that we need to know about immediately so that we can get you the help that you need at that point. We do not want you taking any products such as aspirin, Motrin, Advil, or Aleve, because they will lower your platelet count and as well as make you more susceptible to bleeding. We want you to follow our bone marrow transplant diet. If you are an auto patient, we want you to follow that for at least 100 days post-transplant. If you are an allogeneic patient or a patient that has received someone else's cells, you need to follow those guidelines and as long as you are on an immunosuppressant medication. If you have any questions, we will be happy to answer them for you. I am up on the unit. I will be working with you up there, and we will be more than happy to address any questions that you may have.